everybody. Dr. Thomas Sneed in today. He's a general oncologist and ready to answer your questions about cancer. Good to have you.
Thank you so much.
Yeah, this affects so many. I mean, everybody knows someone or has someone in their family who has suffered from cancer at some point. So we're glad that you're here with St. Vincent. Let's get to the phone lines. We're going to start with Dewey, and it says you're from Arlington, Texas. Dewey, hi.
Hi.
Where are you this morning? Are you visiting Arkansas?
Yes, I am.
Where are you?
I'm in North Little Rock.
Okay. Very good. Okay, what's your question for the doctor?
When I had a CAT scan and an MRI done on my cervical area of my neck all the way down to the pelvic and through the abdomen, when the report was read, how do I know if the person that read the report was qualified to tell me about adenomas? And would I need a second opinion to find out specifically if a 1.7 centimeter adenoma was cancerous or not?
Well, typically adenomas have a characteristic appearance on CAT scans. CAT scans are not perfect, of course, and sometimes MRI scans are required to decide whether or not they're truly benign appearing, but they do have a typical appearance, and a qualified radiologist can usually tell what that appearance is. Typically they are monitored, and if they get larger, then they're considered for biopsy.
Okay, and I guess you would tell any patient if they're not comfortable, a second opinion is not a bad idea.
Yeah, second opinion is never wrong on anything.
Yeah, so feel comfortable doing that. Okay, thanks, Dewey, and welcome to Arkansas today. All right, we're going to get to Ina, who's in Gurdon. Hi, Ina.
Hi.
Hi, what's your question?
I was wanting to ask the doctor, why is epiglottis cancer so hard to diagnose? My husband had been treated for 2 years and went to 3 different ENTs plus family doctor with all these symptoms. And 6 weeks before he passed away, it was discovered he had it. And it had already spread into the lip system and his right side of his neck. Why is it so hard to diagnose?
Well, it's not necessarily hard to diagnose, but different people have different appearances, and if it's a small cancer, even though it causes symptoms, sometimes it spreads to lymph nodes before it's really noticeable. You have to notice something or see something in order to biopsy it. But symptoms of this cancer are commonly sore throat, difficulty swallowing, those sorts of things.
He had all those symptoms, plus severe pain in the right side of his ear, complained of ear pain.
Right.
And but he died from complications of chemo. But I've just tried to figure in my mind if the doctors missed it for those 2 years that he was going from doctor to doctor.
Sometimes you guys have to kind of start ruling out things before you ever, are able to diagnose what it actually is.
There are so many benign conditions that can mimic cancer that frequently cancer is not picked up until it causes enough symptoms to cause a biopsy or has a characteristic appearance, unfortunately.
Okay, thank you so much, Ina, and we're sorry for your loss. Let's get to Candy. She's on the line in Pine Bluff. Good morning, Candy.
Good morning.
Good morning.
I have a question. My mother's been battling melanoma, skin cancer, and where it started from like a seed wart on the back of her leg, and I have the exact same seed wart on the back of my leg, and I was wondering, is it hereditary? Is it something I need to be concerned about?
Yeah, of course you need to be concerned about it, especially if you have any sun exposure. However, melanoma is not typically familial in nature. However, people from certain ethnic backgrounds, usually more often Caucasians or people of Scottish or English descent, are more commonly diagnosed with melanoma. But the big issue is sun exposure and protecting yourself from the sun. Sunscreen is very important, and the most important thing to do is if you have something that appears unusual to you, it's never wrong to see a dermatologist, and I highly recommend that.
And then they can send you on to an oncologist if that's necessary. Are we seeing melanoma cases go up or down? Because we keep hearing about sunscreen.
They're going up. They're absolutely going up, unfortunately, because people are not listening to the admonitions against being in the sun and it's becoming more and more of a problem, and it's a very difficult cancer to treat, unfortunately.
Unfortunately, well, sunscreen, and sun-reflective clothing and all those things that we talk about here on the show so much. We thank you for coming,
Thank you
Dr.
very
Sneed.
much.
Thank you so much. Let's put up the information about Arkansas Oncology Associates. If you have any other questions, don't hesitate to give them a call, ask questions, maybe set up an appointment with a doctor there. And we also thank St. Vincent for bringing Dr. Thomas Sneed to us as well today on Good Morning Arkansas. Thank you. Hope you have a good weekend.